Hi, my name is KMallon, and I'm here to talk about whether or not prisoners should be allowed to participate in clinical research while incarcerated. So currently there are roughly 2.2 million people incarcerated in the United States. As you can imagine, prisons are overcrowded, underfunded, and not only do they house a rapidly aging population, but there's an influx of infectious disease, psychiatric and substance abuse disorders, and other very serious medical problems within the walls of a correctional facility. Even though medical treatment has slightly improved in such facilities, they don't have the same opportunities that we have outside in society. So clinical research gives prisoners an opportunity to receive treatments that they normally wouldn't have available, and also gives the opportunity for research to expand the evidence base for such interventions. What is clinical research and why is it important? So by definition, clinical research is the comprehensive study of the safety and effectiveness of the most promising advances in healthcare. It involves people who volunteer to help us better understand medicine and health. Clinical research is key to improving care for people in the community and around the world. People in the community also includes those incarcerated. So 100 years ago, the medical advances that we have today, the medical, treatments and antibiotics and vaccines didn't exist. The only reason they are on the market today is because of medical research that has occurred over the last 100, 200 years. Antibiotics that we have available today didn't exist 200 years ago, and the reason they're on and available today is because of people that voluntarily signed up for such studies. So when dealing with clinical research, you need people of different ages, health statuses, races, gender, ethnicity, and cultural background to participate. The diversity pool helps to increase the chances that scientists and clinicians will develop treatments and procedures that will be safe for all people. Potential volunteers are all carefully screened to ensure that they meet the requirements of any study before they begin. So you need sick people, you need healthy people, you need people from all walks of life to successfully run a clinical trial. What is the bioethical connection between those incarcerated and medical research? So medical experimentation on prisoners is a hot topic. It's like a double-edged sword. People think that exploiting prisoners because they are incarcerated is, it's just like an easy subject pool, but that's not the case, because think if you were incarcerated and facing life in jail, but you had cancer and none of the treatments that were available to you were working. Is it really? They're not forcing you, and if you saw a doctor and they had an experimental procedure or treatment available, you can't be forced to take it. It's completely on a voluntary, platform. You would have to volunteer for such treatment. So while some may argue that, prisoners are forced to, they're absolutely not. You have to actually sign up for these clinical research trials. What are the pros? So the pros for prisoners joining a clinical study, for example, after years of studying HIV positive inmates, the successful implementation of testing and intervention strategies led to a 75% reduction of AIDS-related deaths, a decline that is similar to what has been seen in the community. And this is because people have volunteered for these studies. The right to science should be across the board. Anyone that is competent enough to make a decision should be able to make a decision whether or not they would like to participate in a study versus whether or not they would not like to participate in a study. The ethical theory associated with the pros is Hi, my name is KMallon, and I'm here to talk about whether or not prisoners should be allowed to participate in clinical research while incarcerated. So my introduction is that there are roughly 2.2 million people currently incarcerated in the United States. Unfortunately, as you can imagine, prisons are overcrowded, underfunded, and not only house a rapidly aging population, but also a huge population of people with infectious disease, psychiatric and substance abuse disorders, and other very serious medical issues. Even though medical treatment has slightly improved in the correctional setting, research-based medical services are needed to improve the overall care in prisons. Clinical research has the potential to give prisoners an opportunity to receive state-of-the-art care that wouldn't typically be available in such settings. At the same time, these research trials have historically put prisoners at risk for abuse. What is clinical research and why is it so important? By definition, clinical research is the comprehensive study of the safety and effectiveness of the most promising advances in patient care. Clinical research requires people to volunteer to help get a better understanding of medicine and overall health. It's a key component to improving care for not only people in our community, but people all around the world. Everything that we use in medicine today was once tested by volunteers who took part in clinical research studies. What we have on the market today didn't exist 100 years ago, and the reason such medical advances are available today is because of the people who volunteered in such trials. These trials require people of different ages, health statuses, races, genders, ethnicity, and cultural backgrounds to help increase the chances of a successful outcome. All volunteers are carefully screened to ensure that they meet all of the requirements of the said study before they begin. What is the bioethical connection between research and the incarcerated population? Research and clinical trials can also be seen as medical experimentation. These principles are accepted as basic rights for every human, but in a correctional setting, some of these principles are easily lost. Prisoners have the absolute right to participate in research, but there are absolute fears of exploitation. Tight regulations are necessary and participation must be completely voluntary for it to be ethically acceptable. What are the pros of a research study in a correctional setting? By including incarcerated individuals, researchers are afforded the opportunity to find meaningful ways to improve the health of inmates. The overall benefits of research involving prisoners have positively impacted the prison population as well as society in general. The right to science is an emerging human right that should absolutely be afforded to prisoners as well as any other individuals that are willing to participate. The ethical theory most closely associated with the pros is utilitarianism. Because research promotes the greatest amount of good for the greatest amount of people, despite the negative claims, clinical research benefits the overall majority for both the incarcerated population and the free world. Some cons that we should highlight about research in the correctional setting is that prisoners are a special population and are easily manipulated because of their restrained liberties. They have a much greater potential for exploitation. Inmates often find themselves in situations where they are unable to protect their own interests because of the pressures by the correctional staff and the fear of sanctions for noncompliance. Prisoners are also susceptible to abuses because of their constrained autonomy. Because they exist in such a tightly controlled environment, prisoners often feel that the system may favor them over other prisoners because of their participation. Another big problem is because prisoners are unable to negotiate for better health care, they are more inclined to enroll in clinical studies in hopes that there will be a favorable outcome. The theory most closely associated with the cons is genealogy, because in some cases the intention to attract subjects is of ill origin. Depending on the research study, scientists sometimes have a hard time recruiting subjects, and prisoners are the perfect target pool because they don't have anything else going on, and most of them are extremely vulnerable. In conclusion, although prisoners exist in conditions that restrict their healthcare and economic freedoms, research studies or the possibility of access to healthcare that would otherwise be unavailable, as long as the risks and benefits are balanced, prisoners should absolutely be able to participate in research studies at their own will. Not including them or giving them the opportunity to participate is equally unjust. The overall goal is to improve the care of prisoners and society in general. Thank you.